people are not aware of the value and their power as maximal aggregators of their personal data. We have all basically given in to the fact that yes, the data stays with the doctor, or with Facebook when we use WhatsApp, or with Runtastic when we go jogging. In the last 13 years since the smartphone was introduced, we've just started to use free services, and we are used to giving the data away. So I think that the empowering and the equalizing power of personal data and personal health data is totally underestimated. See, health data sharing is absolutely key for personalized medicine and even more for personalized health. We need access to lots, millions of data sets from people. And not only genome data sets, but the genome data sets have to be enriched by the medical records of this person and by the smartphone health data that this person records 24/7. And this combination is only possible, can only be authorized by the individual. You and I may not earn the same amount of money, but we're all billionaires in genome data, right? So MiData is a citizen-owned cooperative that offers a digital platform to securely store personal health data, whether this is genomic data or medical records or food data or data that you record on your smartphone. And it's a way where you can actually provide access to this data to research studies or to data services that you may want to use to lose weight, or for a second opinion for a doctor. It's you are in charge. It is a not-for-profit cooperative in the sense that all the money that is generated, if Hoffmann La Roche or Novartis or the WHO wants to access the data that people are willing to share, they will have to pay money. And this money is actually the value of our data, and that should go back to society. That's the thinking in the data cooperative, MiData cooperative. Articles of association, the bylaws of the cooperative, basically the constitution of a democracy, that we said we could not offer financial incentives to share the data. And the argument is that if you offer financial incentives, then people will either use this, people will share data because they need the money. And there is a good example with blood donation. In the United States, you get $70 for a blood donation, and only the homeless people go because they need the money. In Switzerland, and everyone goes because they feel obliged as a contribution to society. So we felt in the MiData model, we felt that offering financial incentives sets the wrong triggers. So a cooperative is a special kind of company, but it's a company that is owned by its members, and it is governed by this one member, one vote principle, much like a democracy. It's actually a commercial democracy. We've chosen the form of the cooperative, not only because traditionally this is has a long tradition in Switzerland. It's everywhere in all countries, also in India, there are cooperatives where people get together and try to help themselves. Okay, so it's a security, it's a trust framework to say, yes, I'm going to store my data there and I'm going to share the data. Democratically controlled, it cannot be taken over by companies. And it's also different from a foundation, which is also not for profit, because a foundation to me is like a monarchy. It's reigned by the foundation board and by its statutes, and the members have nothing to say. They give in the data, they trust it does not change. It will not be bought by Google because that's the framework. But we're living in democracies. We want to be part of this, and we want to engage in selecting the members of the board, etc. So that's why the cooperative is a unique opportunity, is a unique way of a governance for a company. The cooperative is still the right model. This one member, one vote principle, this democratic governance inspires trust. And it fits so well to the fact that you're a billionaire in genome data and I am a billionaire. And we all take about the same number of steps and have the same number of heartbeats. All your data is together, your medical records, your genome data, your smartphone data. Alone, it's not very valuable. It's not your data that is valuable. But if we together pool all these data, that's where the value comes from. And that value should go back to society. I think health data or personal data in general are extremely valuable, but they're also, given the fact that only each individual has the maximal aggregation possibility, they're also a great leveler for digital society. Because it gives each individual, whether you live in Ghana, in Bangalore, or in Zurich, the same amount of power if we organize it in such democratically controlled cooperatives. So we can come from a monopoly setting that Google, Facebook, or China is at the moment, where we talk about surveillance capitalism in the American model or the state surveillance based on the Chinese model. We come to a third model for the rest of us, which will then be adopted as well. Because we can aggregate more data than Google can, and maybe even more than China can.